we're very passionate about in bringing this sort of treatment to as many people as possible. It's also a full circle moment for me coming back to Brisbane. So I started out as a remedial massage therapist in 1999. I worked for All Sports Physiotherapy, worked for the Broncos, had my own practice, and then it's been a long, exciting journey since then. A lot of changes, but everything I've done from then has led me to this point, which is very exciting. So I'm going to go through and give you some education about photobiomodulation therapy, how it works with the MLS laser every step of the way through the cancer treatment process, and how we're minimising the side effects during cancer treatment for accelerated recovery timeframes, improving quality of life. So let's kick on. Okay. So I don't think I need to go through this slide because David's done an amazing job. Thank you very much. But that's what I wear on a day-to-day basis. This is why I like to get out and to dress up on these occasions. But I have my own clinic. It's a very busy clinic in Erina in New South Wales. I started that particular practice in 2017. Trailblazing also with the use of the SOZO, which is a bioimpedance spectroscopy unit, to measure the levels of fluid within the tissue for the early monitoring for breast cancer-related lymphedema and any other cancer-related lymphedema, because the principles are the same across the board with various cancer treatments, with lymph node removal and then the adjuvant chemotherapy and radiation therapy and surgeries. So, as David was talking about earlier, cancer treatment, there's a lot of collateral damage after cancer treatment. There's survivorship. And survivorship these days with the technology, with the radiation and the chemotherapy, providing people with that ability to live longer after cancer diagnosis. But there are side effects which impact quality of life quite significantly. And some of those is with oral mucositis, which can be developed through head and neck cancer, radiation chemotherapy, but even other cancer diagnosis, and with the treatment of chemotherapy and certain chemotherapy drugs, patients still develop oral mucositis, which is they're painful ulcers. And I'll talk a little bit more about that when I'm talking about the MLS laser and how effective that is in minimising those side effects during cancer treatment. Radiation burns, very superficial, but also causing radiation fibrosis, which is very painful and also can lead to reduced range of movement in various parts of the body. Lymphedema is another side effect, and that can be a side effect from the development of radiation fibrosis, but it's also a side effect from various surgeries with lymph node removal and surgeries to remove cancer tumours. And so then you've got the post-surgical complications with postural changes. Cancer-related fatigue is fatigue like no other, and it is a condition. And so I'll talk a little bit more about that also, and peripheral neuropathy. There's a lot of side effects. And we're actually able to help people using the technology that we have, especially during cancer treatment, to minimise the impact of those side effects. So as cancer rehab practitioners, it's our job, to monitor for the early signs of cancer-related lymphedema, and we can do that at diagnosis. by taking a SOZO measurement of a healthy at-risk limb. So we've able to monitor those levels of extracellular fluid within the tissue. So the lymph fluid sits just within the tissue, and so we're measuring, we're differentiating between the intracellular fluid and the extracellular fluid, and we're able to keep track of that extracellular fluid quite closely and pick up signs and symptoms before people can feel or see them. And so then we're able to put risk minimisation techniques in place or treatments in place. Again, understanding the side effects of cancer treatment, and that includes the side effects for women going through breast cancer, being prescribed the hormone blocking medication, and even men going through prostate cancer. There are also, some of those are on hormone medications. So there's many side effects that we need to understand and be able to educate patients. The sequence of cancer treatment and exercise prescription. So exercise prescription is also a very important part of what we do to minimise the cancer-related fatigue, but also mitigate the side effects of osteoporosis from radiation and the aromatase inhibitor medication. And that, all of that comes in patient education, because knowledge is power. And if we see people at diagnosis and through that early stage of cancer treatment, then the patients are in a better frame of mind and they're better prepared for what comes next at each step of the way through cancer treatment. And then we treat the side effects of cancer treatment, and we're that extra layer of support in when they do come to a place like this, where it is a nice, relaxing environment, and we are that extra level of support for patients to be able to share what they're going through. And so the treating the side effects, we see people immediately post-surgery. So being able to use this technology with the MLS laser, it has a robotic Charlie head. I'm just going to bring it out over here because it's going to help me explain it. So this part here is it's a robotic component. So when we see people immediately post-surgery to help facilitate the tissue healing process, whether that's for post-breast cancer surgery, head and neck cancer surgery. I'm going to use those two examples tonight. We don't need to be disturbing the surgical bed. That component sits 20 centimetres above the tissue. So we are facilitating faster tissue healing process. And in those early stages of post-operative treatment, we're also able to observe if there's any other red flags like cording or infection, seromas, and we're able to communicate that with the surgical team or the oncology team. So the early intervention is really key, and I'm going to continue talking about that tonight. Reducing oral mucositis symptoms. We see people during radiation for head and neck cancer. We have an intraoral handpiece, which we're able to deliver treatment. This is all based on evidence. It's very high level research, and I'll talk about that in a second. And so we're following the high level research that is available and demonstrating that that it works. So for oral mucositis, the World Health Organization has categorized oral mucositis in 4 stages. Stage 1 is no oral mucositis. A person's able to eat, swallow, speak. Up to stage 4, where it's life-threatening and they need a peg tube for nutrition. They're unable to swallow and speak. And so the research has demonstrated that using this technology during the treatment, we're minimising that progression up to stage 2, where they're still able to swallow. They're still able to eat. And then the healing process after that is fast. and they maintain their swallowing mechanism. We're softening radiation fibrosis for those patients who haven't seen us during their cancer treatment, and they've already developed radiation fibrosis. This technology softens it. We're using our manual techniques. I use also modern cupping techniques to help soften that radiation fibrosis, but the laser is phenomenal. Reducing the likelihood of radiation dermatitis in breast cancer and head and neck cancer treatment. So we're seeing women throughout their radiation treatment to minimise those symptoms. Reducing lymphedema symptoms with that early monitoring process, but also one of those components is exercise. The lymphatic system relies on the muscle pump action of the body. So by including exercise during their cancer treatment, we're minimising the likelihood or the development of lymphedema symptoms. But the exercise prescription as well is promoting the muscle pump action, muscle mass, and maintaining bone density. So there's so many different aspects of exercise that are so important in cancer rehab. And we've got Morgan here tonight who specialises in that area of practice, which is really nice to have you here tonight as well. We're also reducing chemo-induced peripheral neuropathy. So that's numbness and tingling in the hands and feet. Hand and foot toxicity, which is a burning sensation. We are using the laser to minimise those symptoms as well, and it speeds up recovery timeframes. So the referral pathway. So we get referrals from surgeons at that prior to treatment commencing. So we can get a SOZO reading, a measurement of the LDEX of a healthy at-risk limb. Even if patient is going through starting with neoadjuvant chemotherapy, which is the chemo prior to surgery, we still need that healthy baseline because chemotherapy, it's the accumulative effects of chemotherapy that increases total body water. And so when there is a compromised area of the lymphatic system, then that part of the lymphatic system is not going to cope with that increase of total body water. So we still need to be able to measure that quite closely. Again, so then we see them immediately post-surgery, during the radiation treatment, and right through, and I've got a case study that I'll talk about, but it's the recovery timeframe when they have finished their treatment is fast and they're back to doing their normal day-to-day activities quicker. And so that's just some components there. So that's the SOZO, that's the bioimpedance spectroscopy unit, BIS for short. That monitoring process, the levels of risk of developing lymphedema vary depending on the level of surgery, the number of lymph nodes that have been removed, and the adjuvant treatment that's going to follow. And so you tend to monitor someone more often if they have had the surgery and then chemotherapy. That increases the risk tenfold. And so we wanted to be able to monitor them quite closely. This is the use of the laser in use. So you can see the Charlie head is sitting 20 centimetres from the tissue there. And we're able to treat two places at once. So I could be treating someone's breast area, and then we're also treating the axillary area and the arm, for example, in breast cancer cases. It speeds up treatment. We're able to provide so much more within a treatment time frame. And it makes manual lymph drainage so much more efficient and optimal because of what the laser can achieve. So, photobiomodulation therapy. The unit of energy that's delivered by the light is a photon. It interacts with the mitochondria of the cells to produce a number of different biological effects. So photobiomodulation, we're modulating the activity of the cell to create a number of different biological effects. And I think, okay, we'll go here. So the photons interact with the mitochondria of the cells. We're increasing ATP energy. So that's increasing the cellular activity for tissue healing. It's releasing nitric oxide from the cell, which vasodilates the blood vessels. So we're increasing the blood flow to an area of healing, increasing the hemoglobin transportation and increasing nutrient transportation. It's also vasodilating the lymphatics. So we're reducing swelling, so increasing the function of the lymphatic system. In that process, it also reduces the production of pro-inflammatory cytokine protein production and builds anti-inflammatory cytokine protein production. So that's that anti-inflammatory benefit, and also has an analgesic effect where it's blocking that pain stimulus. So the MLS laser is used across a wide range of modalities. You know, we're looking at dental. It's also in physiotherapy, chiropractic, podiatry, and we are world leading in the use of the MLS laser in cancer rehabilitation. And so it uses two light wavelengths simultaneously, a continuous and a pulse, and it's that synchronized use or delivery of the two light wavelengths that prevents tissue heating or tissue burning. This technology is patented technology developed in Italy over 40 years ago. So medical lasers have been around for 50 years. This company who has developed the MLS laser has been around for 40 years. So this is a patient of mine. So the red that you see is just to indicate that the laser diodes are on. The light that's delivered sits on the infrared to near infrared light spectrum. So that light is invisible. The light travels 3 to 4 centimeters subcutaneously into the tissue. And so there's no heating, there's no burning, there's no discomfort. The patient cannot feel when the Charlie head is directing the treatment to the area. So this patient here, we saw her immediately post-surgery. She had a bilateral mammoplasty after a lumpectomy, and so we were able to facilitate that tissue healing process. She also had lymph node dissection, but also developed cording. Cording is when the lymph vessels that are travelling into the lymph nodes have nowhere to go, and then they attach themselves to the surgical site and become cords, and can be very painful. And so you lose range of movement in the arm. You also see it also after head and neck surgery as well. So by seeing a patient immediately post-surgery for that tissue healing process, it's also our job to be able to make sure that they regain their range of movement in their arms, so then they can ready to go for radiation and they've got full range of movement. This lady we also saw throughout her radiation treatment, based on the evidence that is available, to minimise the development of radiation dermatitis. But what we have also found that it slows down the development of radiation fibrosis. And how radiation fibrosis forms, it's the healing process of the body. So in a normal situation, from injury or surgery, the body lays down collagen fibers to heal that tissue. So when you look under a microscope at our normal tissue, our normal undamaged tissue, it's laid down in waves. So when the body's healing itself, it's laying down collagen fibers, it's laying down like bricks, so it's less mobile than our normal undamaged tissue. after radiation, the body goes into an inflammatory response. And so there's an excessive amount of collagen fibres that are laid down. So you get these laying down of bricks, and that tissue thickens. And left untreated, that tissue becomes thicker. It can be very painful to touch. Due to the superficial nature of the lymph vessels, due to that thicker tissue, you're going to get impedance of the superficial lymph vessels. And so you can develop lymphedema symptoms off the basis of that. So I tried really hard to, is this going to, no, that, oh no. Where am I going? No, that wasn't playing. Okay, that's fine. Just going back to treating during radiation, it is slowing down the development of radiation fibrosis. And so that tissue remains nice and soft and mobile, and reducing the risk of developing breast cancer-related lymphedema and breast edema. And it's the same principle during head and neck cancer. So the research using the MLS laser has commenced in 2013. There's a number of researchers in Belgium who have been using the MLS laser in their research, and their research has been high-level research, especially the transdermis trial and the dermis head trial using the laser during radiation in head and neck cancer and for breast cancer treatment. So this is the dermis head trial. They had 46 patients that were seeing twice a week throughout this radiation treatment from the start of radiation in head and neck cancer. And there was a decrease in the level of radiation, acute radiation dermatitis. And so that's what I'm also seeing in my clinic with the head and neck cancer patients throughout their treatment. But what we're also seeing is the healing process of the tissue after radiation in head and neck cancer treatment is phenomenal. And in a lot of my patients that I see on a daily basis that are going through radiation, the healing process, it doesn't even look like they've had radiation. We're also treating using the intraoral handpiece to minimise the development of oral mucositis. Another finding is that they're maintaining their swallowing mechanism, which we were at the Australia-New Zealand Head and Neck Cancer Society conference last year in Adelaide, where I presented, and I had a lot of communication with the speech pathologists there, and their main concern for the head and neck patients was losing their swallowing mechanism. And when they lose their swallowing mechanism, then there's a PEG tube that's inserted so they can continue to receive nutrients. And the cost of that to the hospitals is approximately $10,000 per PEG tube. So if we can minimise even that cost on the hospital system, then we're helping a lot of people. And so that's the research article there. We can provide information on that later. The role of photobiomodulation therapy in minimising chemo-induced peripheral neuropathy. So it's the accumulative effect of chemotherapy that can damage the nerves in the hands and feet, and also cause inflammation at the nerve axons. And so there are other symptoms called hand and foot toxicity, which is a burning sensation. Because of the, so our nerves have cells, and so we are rejuvenating the cellular activity within the nerves to minimise the peripheral neuropathy. But we're also reducing the inflammation at the axons of the nerves minimising the hand and foot toxicity. Early intervention is key, because if peripheral neuropathy is not treated and left down the track, it is harder to turn around. We can minimise the symptoms, and there's been the odd occasion where there's been complete resolution of their symptoms, but it's a lot harder to reverse if we see them, if we don't, it's harder to reverse than if we see them during their cancer treatment. And we have successfully reversed and minimised those symptoms using the laser. So this is one of my cases, a 44-year-old lady. She was referred to me by Professor Dion Forstner, who's with Genesis as well. I saw her a week post-surgery to start facilitating that tissue healing process. We saw her twice weekly for 5 weeks. She had 25 fractions of radiation, that's 5 treatments per week. She did develop grade 2 oral mucositis, but we were able to stop it at that. And she was also able to maintain her swallowing mechanism. And so that was the healing process from surgery. So she had a full neck dissection. That's the dissection of the lymph nodes in the neck. And there was no development of lymphedema. So when we see people, if they haven't been able to see us, it can be 4 months after treatment and they've already developed chronic radiation fibrosis and lymphedema symptoms. And dry mouth. Dry mouth is another symptom of radiation. That is also hard to reverse. If we see people during their cancer treatment, those symptoms are significantly minimised. She doesn't have dry mouth. She can still swallow. She's a physiotherapist. She got back to work quite quickly. And her treatment, her cancer-related treatment, was quite significant. This lady here, I saw she had 2 surgeries. The initial surgery to remove the right lesion of tongue, and then she had a flap graft from the right side buccal. Had radiation treatment to the entire neck. She had a full neck dissection, and also referred by her radiation oncologist and surgeon. She had an outstanding recovery. She also developed up to level 2 oral mucositis, but that was stopped right there. And the healing process of that, again, was fast because we saw her right through her radiation treatment. She maintained her swallowing mechanism. She didn't get dry mouth. I saw her the other day and she looks absolutely amazing. And that's her recovery. That was 18 weeks post radiation treatment. And you can see she looks great. And even, you can even barely see the surgical line. She just has a bit of a mechanical issue because of that buccal flap graft. But other than that, she's quite incredible. And the extent of the treatment that she had, if she hadn't received the MLS laser throughout the treatment, she would have had a very, very different recovery and would have developed quite chronic side effects. So again, the referral pathway, it'd be fantastic if we saw, it should be gold standard of care that we see people at diagnosis. It should be gold standard of care that we see people immediately post-surgery and during radiation treatment. And this is why we're so excited to have Leading Light Rehab deliver this treatment here in Brisbane and be the first in Queensland to deliver it. There'll be many patients that will be wanting to travel a long way to receive this treatment.